Okay, hello everybody. I am Dr. Chris Mascetta with Ridgefield Chiropractic and Wellness Center. First off, I want to wish everybody a happy new year. I hope the ending of the year was great and your holiday season was awesome. I know we had a really great one. But anyway, we are very excited to start a new year here at Ridgefield Chiropractic and Wellness Center. It was a great year in 2024, but we're excited for 2025. First off, big news is that it's our 25th year anniversary. So we're pretty psyched about that, and hopefully we'll do some different things throughout the year to celebrate 25 years of practice. We're certainly very grateful for all of our patients and everybody in the community that have made this possible. So anyway, if you haven't been in the office for a while, in 2024 we actually renovated it. It was a mild renovation, but the office looks great. We painted the entire office as well as added new countertops. These really great Italian, I don't know, kind of like stone countertops that really look great, and we put some new pictures on the wall. So anyway, kind of refreshing the office that we're excited about, especially with the 25-year anniversary coming up. So also some of the things we are excited about is that we want to add some new services to the office. We always want to keep things fresh and provide new services to our office and our patients to improve their overall health and well-being. And one of those is I really want to focus on functional medicine and my functional medicine practice. We do have Dr. Sousa here, who's a naturopath, and obviously a lot of what she does is functional medicine. But as a chiropractor, it's something that I want to focus on more. I feel in today's day and age, there's more and more against our health, and to stay healthy has been a challenge, and to get really great results in the practice has been more challenging because there's more stress out there than ever, whether it's a physical stress, chemical, nutritional stress, or emotional, spiritual stresses. People are under a lot. So we have to get creative with figuring out different ways to improve our patients' health. And I really do believe that functional medicine is a way to do that. So anyway, I'm newer to StreamYard, so I'm not really sure how to do the split screen. So I wanted to do a PowerPoint presentation. I don't think the PowerPoint slides are up. I could see them on my screen, so I'm going to be reading them. And we could always do this again once I figure out how to use it better. But for anything, I'm just going to read through the slides and just do an introduction to functional medicine. So the name of the presentation is the overview of functional medicine, focusing on root cause healing rather than symptom management. So let's go right on. So let's see if I can get this to switch. There we go. So functional medicine, what it does, it provides a foundational understanding of the principles and practices of functional medicine, which focuses on identifying and addressing the root causes of disease by taking a holistic approach to a patient's health, considering factors like genetics, lifestyle, environment, and considering the body as an interconnected system, rather than just treating symptoms individually, emphasizing a patient-centered approach to create personalized treatment plans based on individual needs and factors contributing to their health and concerns. So that's a lot of information right there. But let's go on beyond that. So what are the key points of functional medicine? What do they include? Well, the core principles of functional medicine is the concept of treating the why behind a disease, not just symptoms, by exploring the underlying imbalances in the body systems. The systems biology approach, which means understanding how different bodily systems interact and influence each other, considering the interconnections of the body. Anyway, and it's really a patient-centered approach to care. Engaging the patient's activities in the treatment process, gathering detailed information about their lifestyle, diet, stress levels, and family history to create a personalized plan. Using different types of diagnostic tools. As a chiropractor, we can order things like blood work and all different types of labs. So utilizing advanced laboratory testing beyond standard blood work to assess potential imbalances in nutrients, hormones, and toxins. Okay, so it goes beyond just going to your typical, like maybe primary care doctor who may have to really stand to the guise of what they say the best practices through insurance are. Functional medicine goes beyond that to look for the basics of your lab work, but also go dive in a little bit deeper. So lifestyle interventions, prioritizing dietary modifications, exercise, stress management, and sleep hygiene as key components of treatment. And it's an integrative approach. So, considering conventional medicine alongside complementary therapies when appropriate. I always say the best sign of the best holistic practitioners are the ones who know when to refer to the primary to medical doctors or more specialists. You can do what you can, but if things get out of control or beyond what we can handle, you want to have good practitioners that you refer to. So functional medicine has many benefits. So what are the primary benefits of functional medicine? Well, we already talked about personalized care. It's a holistic approach. It's preventative medicine. We want to keep you healthy, and integrative therapy. So let's break each one of these down. So personalized care. So it's functional medicine considers each patient's unique health history, lifestyle, and biochemistry to create a personalized treatment plan. It's a holistic approach. So, functional medicine takes a holistic view of the patient's health, addressing the root cause of illness and promoting overall balance and vitality. So, what does that mean? So, we look at the body as a whole. A lot of times when you go to a specialist, they may just be a GI specialist, a pulmonology specialist, a neurologist, an orthopedist, and they may not necessarily be looking at the body as a whole and how all the systems interrelate. I always say that a specialist is somebody who knows more and more about less and less, and sometimes it gets so pigeonholed they forget about how the rest of the body may be functioning, may be interacting. And sometimes symptoms may arise as one system, but may be coming from somewhere else. Okay. Uh, so, so holistic approach, functional medicine takes a holistic view of the patient's health, addressing the root causes of illness and promoting overall health, balance, and vitality. Preventative medicine. So functional medicine can help prevent chronic diseases by identifying and addressing risk factors early. So I love this fact about prevention because we really want to not only improve a patient's health, we want to prevent the future illnesses and diseases, by acting now. So integrative therapies. Functional medicine combines conventional and alternative therapies such as acupuncture, medication, and herbal remedies, and chiropractic. Chiropractic is a great way to adjust the body to improve neurological function and to improve your overall health and well-being. Functional medicine has many benefits, including lifestyle interventions, empowerment, patient-centered care. We've talked about that already. Biochemical individuality, and identifying stresses as a cause of dysfunction. So, lifestyle interventions. What do we mean by that? So, functional medicine often includes lifestyle interventions such as therapeutic food plans. I always want to start with food, improving the diet. Movement practices. I mean, obviously, that's really important as a chiropractor. We want to keep patients moving the best we can, and stress management techniques. Which you have to look at three different components of stress: not only physical stress, but nutritional, chemical stress, as well as I believe emotional and spiritual stress as well, and find answers to each one of those things. Empowerment. Functional medicine provides patients with knowledge and tools to make informed decisions about their health. Patient-centered care. Functional medicine focuses on getting to know the patient, not just their illness. Biochemical individuality. So functional medicine takes into account how individual differences in genetics and environment can impact health outcomes. And identifying stress as a cause of dysfunction. So functional medicine focuses on identifying stress as a cause of dysfunction and using interventions like exercise, meditation, and yoga, and of course things like chiropractic are in that as well. And also, some of the benefits of functional medicine is it makes you feel great and improves your overall health and vitality in its years to your years. So what do I mean by adding years to years? Well, you don't want to just get old. The goal of life shouldn't be just to get old. You want to be old, but also healthy and functioning. I always tell patients all the time that, I want them to experience their great grandchildren, but not only getting to know their great grandchildren, but active in their lives, getting on the floor and actually playing with them. We want to really increase the quality of life as you get older. Okay, so last thing is what kind of conditions benefit the most from functional medicine? Well, A lot of times functional medicine is used when all else has failed. Most of the times when people come to the office for functional medicine, it's usually because they've exhausted all the other modalities and been to all different types of specialists, and this is their last hope. And a lot of times this is the answer. So, chronic diseases such as diabetes, heart disease, Alzheimer's disease, things that are a lot of times lifestyle diseases. It's also very effective with autoimmune diseases. Autoimmune diseases such as rheumatoid arthritis, lupus, psoriatic arthritis, Crohn's disease respond very, very well to lifestyle changes and dietary choices and activity and things like that. Chiropractic really works well with the autoimmune diseases. Digestive disorders such as like IBS or IBD, like Crohn's disease falls into this. Ulcerative colitis may fall into this. So even if it's heartburn, cramping, bloating, if you suffer with constipation and diarrhea, things like that, difficulty with digesting, breaking things down. Functional medicine is really, really great. Things like hormonal imbalances, such as thyroid disorders, menopause, polycystic ovary syndrome, things like that, respond really well to functional medicine. Environmental and food allergies. Food allergies is a big topic. Just every year, food allergies become bigger and bigger and affect more in different people. So functional medicine can help identify sources of exposure to toxins and support the body's elimination of them. So some additional conditions that benefit the most from functional medicine: women's health disorders such as PMS, and again, polycystic ovarian syndrome. It's really great for women who are premenopausal or menopausal, postmenopausal, respond really well to functional medicine. Fibromyalgia or the other types of arthritides or muscular problems or joint problems. Functional medicine can help with inflammation throughout the body. Depression, you may not think of that as much, but functional medicine can help with micronutrient imbalances, neurotransmitter deficiencies, and infections. And then asthma, things like asthma respond really well. So functional medicine can help with immune system dysfunction, improving things like asthma or allergies and things like that. So anyway, a quick review of what functional medicine is. Again, I apologize that my PowerPoint didn't pop up on the screen. Maybe it did, I just don't see it here. But that's an overview of functional medicine. Each week we're going to talk about different parts of functional medicine. I may even do this talk again just to kind of go over a little bit more. But anyway, thank you again for all the support that you provide the office. We wouldn't be where we are without you. We wouldn't be celebrating 25 years without our great practice, the great patients, and the great town. So if you have any questions about functional medicine, please don't hesitate to reach out. If you have any of the conditions we talked about and the current modalities that you're using, if they're not benefiting you as much as you'd like, just give us a call and we'd be happy to set up an appointment and see how we can help you. So thank you very much and good night.